everyone. So today I'm going to talk about blood pressure. What's causing blood pressure and how we can avoid it. So basically, what is blood pressure? It is the force which is exerted by the blood into the walls of our arteries that carry blood away from the heart. What is a normal blood pressure? Normal blood pressure is 120 by 80 mmHg. mm is millimeter per mercury. Pre-hypertension is between 120 to 139 and 80 to 89 mmHg, and high blood pressure, hypertension, is greater than 140 by 90 mmHg. These are basically the systolic blood pressure. It means whenever the heart contracts, and this is the diastolic. It is the relaxation between two contractions. So what are the causes of blood pressure? There are many reasons and causes for blood pressure. The leading ones are obesity, high levels of bad cholesterol, diabetes, fatty liver, anxiety, stress. So basically, blood pressure, getting high blood pressure is a lifestyle diseases. So anything which is causing a bad lifestyle, like having a diet which is high in inflammatory foods, like processed junk foods, foods that are high in sugar. These are causing inflammation in our body. These are increasing the amount of oxidative stress. Lack of exercises. These are all poor lifestyle choices which are resulting in blood pressure. Apart from that, smoking. Use of heavy metals like lead, mercury, which is present in environment or available in certain foods that are raising our blood pressure. Sleep apnea. Nutritional deficiencies like deficient in omega-3, magnesium, vitamin D. These are all some causes of blood pressure. So what are the most leading causes of high blood pressure? Is insulin resistance. Now, insulin resistance is something that happens in our body right before pre-diabetes. It is our body resisting high levels of insulin, which is caused by eating foods that are high in refined flour, foods that are high in sugar, processed junk foods, which I mentioned earlier. These are raising our insulin levels constantly, resulting in insulin resistance. These leads to pre-diabetes, and if it's not well controlled, it could lead to diabetes. So these are one of the main causes that are causing high blood pressure. Now, high blood pressure is a silent killer. We don't know we get high blood pressure till the time it reaches some serious complications like kidney failure, stroke, heart attack, dementia. So what happens is the doctor prescribes you medications or a combination of medications. So by giving medications, we are just treating the symptoms. We are not addressing the root cause. What is causing blood pressure? So it is very important that it's a big deal, we need to really address the root cause rather than just focusing on treating the symptoms. Even medications have side effects. So let's talk about first salt. Generally blood pressure patients have been told to reduce or completely stop the amount of salt in their diet. Now, recent studies have shown that sodium, which is present in salt, is very important for our body. It's a very important mineral. It has great benefits. So reducing the amount of sodium is going to, cause us more harm than good. So the studies have shown that rather than reducing the amount of sodium or salt in our diet, it is very, very important that you increase the amount of another mineral which is called potassium to reduce blood pressure. So some amount of sodium is very beneficial, like having about 5 grams of sodium in a day. You can use some kind of salt in your diet, while making food, like rock salt, Himalayan pink salt, even iodized salt, salt which has been fortified with iodine. Now, a lot of people are deficient of iodine. People who are not eating seafood, seaweed, these are good source of iodine. So, people are not having them. Iodized salt is the only form of iodine which are they getting. Even natural foods contain sodium, like meat, milk products, eggs. Green leafy vegetables like beet greens, mustard greens, turnips, they all contain some kind of sodium. So these sodium are very important in a diet. So the salt you're putting on the food is not going to raise your blood pressure. It's the salt which is put by the corporations into the processed foods that is very harmful us, and that is going to raise your blood pressure. So these kinds of processed foods needs to be stopped, because these kind of salt we need to eliminate from our diet. Like processed foods, like your chips, bakery products, biscuits, even condiments like commercial available sauces like ketchup, mayonnaise, soya sauce, processed meats like ham, sausages. Now these are containing high amount of sodium, so such salt has to be eliminated from the diet, not the little bit salt that we are adding in food. Now a lot of people are salt sensitive. Even that small amount of salt is going to raise their blood pressure. So such people can avoid or limit the amount of sodium. But apart from that, regular people can use some amount of salt while cooking food. According to the American Health Association, AHA, they have recommended a DASH diet. This is dietary approach to stop hypertension. They have recommended increasing the amount of potassium in diet to reduce high blood pressure. What are potassium-rich foods? Green leafy vegetables, avocado, potatoes, sweet potatoes, bananas, coconut water. All these fresh fruits and vegetables are extremely good source of potassium. We need to include at least 6 to 7 cups of fresh vegetables in our diet. We need to eat real food. This diet is extremely beneficial for people who have hypertension. Apart from potassium-rich foods, there is another mineral which is called magnesium, which is extremely beneficial for reducing high blood pressure. Include magnesium-rich diet like spinach, green leafy vegetables, mushrooms, curd, kefir, sunflower seeds, almonds. Please include these foods in your diet. Even some amount of dark chocolate. It contains magnesium. So including potassium and magnesium rich foods is going to reduce your blood pressure. Apart from that, vitamin D plays a very important role in reducing blood pressure. Go out in the sun between 8 to 10 in the morning, or after 5 o'clock in the evening when the UV rays are very low. Now vitamin D is a fat soluble sunshine vitamin. Our body produces vitamin D in the presence of sunlight. So please be out in the sun. You can also take supplements of vitamin D. Extremely beneficial for reducing blood pressure. Apart from that, include a diet which is rich in omega-3. This reduces inflammation in our body. Very healthy fats. Like I mentioned earlier, having inflammatory diet is one of the leading causes of high blood pressure. So having an anti-inflammatory diet is going to be of really good help if you want to reduce blood pressure. Include good quality fatty fishes like salmon, tuna, mackerel, fish liver oils, cod liver fish oils, flax seeds, walnuts, chia seeds. Great sources of omega-3. Apart from that, have a fiber-rich diet. Now flax seeds, chia seeds, whole grain cereals, pulses, vegetables are excellent sources of fiber. Fiber also plays a very important role. So please include fiber in diet. Apart from that, reduce the amount or completely stop the amount of processed junk foods. Foods that are high in sugar, fruit juices, bakery products, processed meats. Please reduce this or completely stop them if you want to reduce blood pressure. Even gluten and dairy products in some are causing inflammation. So if you're sensitive to gluten and dairy products, please stop that because we do not want any kind of inflammation in our diet. Now stay hydrated. 6 to 8 glasses of water. Have herbal teas, infused water if you don't like the taste of plain water. But staying hydrated is very important. Apart from that, reduce your stress levels because stress and anxiety is one of the leading causes of blood pressure. So you could do meditation, yoga, tai chi. Deep breathing exercises can definitely calm you down and reduce your blood pressure. Sleep well. Prioritize your sleep. Have at least 7 to 8 hours of uninterrupted sleep because this will reduce cortisol levels, reducing stress, reducing blood pressure. Apart from that, exercise regularly. Do any kind of exercises like even plain walking. Just go for brisk walk, dancing, swimming, cycling, hiking, high intensity workouts, weight training, any workout, any kind of movement. Please be active, try to do workouts like 3 to 4 hours weekly. Just try to stay active. Like I said, blood pressure is a lifestyle disease. So it's very important that you correct your lifestyle so that you can reduce blood pressure. I hope these points were useful. I'll be posting more videos related to nutrition and health. This is Menka Vijay signing off. Thank you.